Services, and I will be the moderator for the question and answer session. Joining us today are Premier Andrew Furey, Dr. Janice Fitzgerald, and the Honorable John Hagee, Minister of Health and Community Services. Minister Hagee is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly. stand by. Our news conference will begin shortly.
Thank you all for joining us here today. I have a very important announcement to share regarding the measures to control the spread of COVID-19 in Newfoundland and Labrador. Back in the beginning of July, when our province entered the Atlantic bubble with Nova Scotia, New Brunswick, and Prince Edward Island, our government committed to monitoring the situation. Subsequently, we've seen almost 4 months of low infection numbers. The Atlantic bubble has been a source of pride, and people outside our region have taken note. I commend you all for following public health guidelines throughout Atlantic Canada and doing your part to allow for some semblance of regular life within the COVID-19 pandemic. But the situation has changed. That original directive leads us to today's decision. After careful consideration and consultation, I have made the tough decision to implement a circuit break. Effective 12:01 a.m. on Wednesday, November 25th, 2020, people arriving in Newfoundland and Labrador from within the Atlantic bubble will be required to self-isolate for 14 days. This is not an easy decision, but as your Premier, as a physician, and as a concerned father and citizen, I must do what I've promised: protect the best interests of the people of Newfoundland and Labrador. Implementing this change for a 2-week period is an effort to avoid a full lockdown. For weeks now, we have watched as the second wave of COVID-19 has gained traction and built momentum across the mainland. It felt like it was just a matter of time before it made its way east, and it has. As we have seen the numbers of infection begin to creep up throughout the Maritimes, our own alarm bells began to sound. I've spoken with the other Atlantic premiers throughout the weekend. We must be responsive now and address the situation today. This is a province-wide preventative medicine measure. We're doing this to protect schools and businesses. We're doing this to protect seniors and the most vulnerable. We're doing this to protect the economy and the freedoms we now enjoy. None of us wants another full lockdown like the one we've just been through or that others have returned to now. We are doing this to protect businesses from the possibility of another complete shutdown. Now more than ever, we need to support each other, and that means supporting your local businesses at this difficult time. We will be monitoring the situation closely to see if the 2-week change to the Atlantic bubble needs to be extended. The circuit break means all travel to and from the province will only be for essential reasons. Again, anyone entering the province from within the bubble must self-isolate for 14 days. They do not have to apply for a travel exemption to come here. If anyone within the group has particularly extenuating circumstances, making 14 days of self-isolation impossible, there will be an option to apply for testing to possibly shorten that time of quarantine. The restriction of travel to Newfoundland and Labrador from outside the Atlantic bubble remains the exact same. And let me be very clear. Rotational workers must continue to adhere to the measures put in place by Dr. Fitzgerald and her team at Public Health. This is of the utmost importance for our many dedicated rotational workers. To this group, I say that I know travel during the pandemic has been stressful enough for you and your families. But please, please, I implore you to follow the provincial guidelines. We have shown that when we do, it works, and it only takes one. We all need to work together and support each other. To that end, I encourage companies in Alberta and other parts of Canada to look at adjusting their own operations. For example, switching to a month-on, month-off schedule for our country's hard-working rotational workers would make a world of difference in the quality of their lives. It would also reduce the amount of travel across the country. Remember that if you are a rotational worker coming from an outbreak site, please remember, self-isolation means isolating by yourself on your property, physically distanced from household members for 14 days. No visitors. And if any member of the household begins to have symptoms, all members must self-isolate and call 811. Do it for your own safety and that of your loved ones. Do it for your community and for your sense of service to our province. I know this is not the news we wanted or needed as the Christmas season approaches, but let me be very clear about this. We must be proactive now, lest we suffer the same fate as other provinces. Our approach to the pandemic has become a model for others to follow. We've all sacrificed a lot and have worked together to keep the pandemic at arm's length. To the workers out there doing the day-to-day jobs that are keeping this province moving during the pandemic, thank you. We all owe you a tremendous debt of gratitude. I know everyone feels a sense of COVID fatigue. I certainly do. But please, we must dig deep and stay vigilant. Respect physical distancing. Wash your hands. Wear a mask. Stay home if you feel sick. Call 811 to get tested if you think you have symptoms. Download the COVID-19 alert app. Do a virtual check-in with those around you. And continue to listen to the advice of Dr. Haggie and Dr. Fitzgerald. We are implementing this 2-week pause now as a preventative measure to stave off the second wave of COVID-19 and hopefully protect the upcoming holiday season. From Snowmageddon to the lockdown, after the year we've put in, we all deserve and should be able to enjoy the holidays. But that's why it's so important to dig a little deeper now to help us all get there safely. Until then, Newfoundland and Labrador, please stay safe, stay strong, and take care of each other. Before I pass it over to Dr. Fitzgerald, I want to add one more thing. To the members of the media, thank you for always keeping the province informed during the pandemic and helping us get the message out there. Thank you. I now invite Dr. Fitzgerald to share her update.
Thank you, Premier. Good afternoon, or good morning, I think it still is. Thank you for joining us today. I'll begin with an update on COVID-19. So since the media advisory yesterday, we have 2 new cases in Western Health. The first is a male between 20 and 39 years, which is related to travel from Manitoba and unrelated to the previous cluster within Western Health. The second is a female under 19 years who is a contact of a previous case. Public health investigation is underway and contacts are in the process of being notified. The total number of cases in our province now is 321 and 294 people have now recovered. In total, we have tested 59,270 people. We have had our first case of COVID-19 in a child that has attended school. Public health officials in Western Health are investigating, and this case is related to previous cluster. I want to go through the process of what happens when we have a case of COVID-19 in a school. As with any case, contact tracing starts by identifying any close contacts of the child. This will include the school cohort or class of the child. In this case, which is an elementary school in Deer Lake, the parents of this class cohort have been notified and the children have been self-isolating and testing has been arranged. The school has been following public health guidelines by keeping cohorts separate, and this reduces the risk of transmission from one classroom to another. While this is not welcome news today, it is certainly not unexpected. We knew we would eventually see cases in schools. This was the purpose of instituting cohorts at the beginning of the school year. We have procedures in place when cases are identified in a school, and public health is working diligently to follow through with the investigation. It is important for people to remember that we have been able to link all cases in Deer Lake back to travel, and we do not have evidence of widespread community transmission in the area. This situation, however, reinforces the need for all of us to be vigilant and to understand that COVID can arise in any community at any time. We all need to follow the public health measures and practice physical distancing, reduce your contacts, and avoid gatherings of any size. We have seen that gatherings have been a significant contributor to outbreaks in the country. We really have been fortunate to live with low levels of COVID-19 for the past several months, but we need to now behave like we did back in April by assuming that COVID is here. Gatherings, while important, will need to wait until we have a significant portion of the population vaccinated. We also know that rotational workers, perhaps more than any other group, have sacrificed the most during this pandemic. For a significant part of this year, they were in a constant cycle of working and self-isolating without time to spend with family and friends. This is why we relaxed measures for these individuals, recognizing we had to balance risk with the well-being of these individuals and their families. We continue to carefully consider the balance of risks and benefits as COVID rages on outside our borders and workers return home to their families. Currently, rotational workers can receive a test on day 5 of their return, and if negative, they can leave self-isolation at day 7. We are making an adjustment in this order, effective Wednesday, November 25th, where workers from a non-outbreak site within Canada will be required to wait until day 7 for their test. The benefit of this change is that it adds 2 additional days past potential COVID exposure, which will decrease the chance of a false negative test. If they receive a negative test, they can avail of a modified quarantine. They can leave their house and visit public places and other family members. They must wear a mask when in contact with people outside of their household bubble, even if that's other family members. They must not attend mass gatherings or crowded spaces and must not enter a long-term care facility, personal care home, or assisted living facility during the final 7 days of their modified quarantine. There will be some leeway here for exceptional circumstances. They must self-monitor for symptoms and call 811 to determine if they need testing. Any adults in the household of a rotational worker must wear a mask when in contact with others outside of their household bubble and should avoid mass gatherings, crowds, and visiting long-term care facilities, personal care homes, and assisted living facilities as much as possible. Starting Wednesday, we will also be making contact with these workers to see if they or their family require support in any way during this 14-day period, and also to provide them with a point of contact for any questions they may have around precautions the family should be taking. We encourage any rotational workers and their family to reach out to natural supports, such as family and friends, or avail of provincial resources, such as the Channel Warm Line, or Bridge the Gap with 2ps.ca. The same goes for anyone in the province experiencing increased stress or anxiety as a result of the COVID-19 pandemic. If we can contain the small clusters we have now and reinforce our defenses against new ones, there is every reason to believe we'll be able to enjoy the holidays with our families. I truly believe Newfoundland and Labrador is at a tipping point. What we do now determines the COVID wave, if the COVID wave reaches our shores. We have seen from other jurisdictions that things can change quickly and take a turn for the worst. I know that many of you are watching the lockdowns and closures in other provinces and territories and wondering if that will happen here. It is entirely dependent on what happens with our provincial epidemiology. Province-wide closures like we saw in the spring are our last resort. Our first line of defense is isolated, regional, and temporary closures when we see an outbreak. There is no formula to determine what this may look like, as it is based on a multitude of factors. We can significantly reduce the likelihood of this happening if everyone can keep their close contacts to as few as possible. The fewer contacts you have, the less opportunity the virus has to spread. I also encourage retail establishments, particularly those with large capacity, to consider reducing the number of people permitted inside to allow for physical distancing if they have not already done so. As a recap, for those who may have just joined us, we have no new cases since yesterday's we have 2 new cases since yesterday's media advisory, and the total number of cases in the province is 321. Thank you to everyone that is listening, taking heed, and adhering to public health guidance. The coming weeks are critical in determining how our province fares, and we need everyone to do their part in pushing against this wave. So hold fast, and thank you, Newfoundland and Labrador.
Thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie.
Thank you very much, Premier. Before I make my comments, I would like to recognize the fact that it's National Addictions Awareness Week this week. One of the group of challenged individuals during COVID-19 have been people struggling with addiction, and we have increased our level of services to try and provide access with minimal barriers through things like doorways and our regional hub and spoke model. But I would encourage anyone who is in a position where they think they may need help to call 811 or avail of these in-person services to access the services we do have. It is day 261 of the pandemic and our 101st scheduled media availability. Dr. Fitzgerald has documented an increase again in cases, and we've certainly seen a rise of quite some magnitude in our active cases. And we need to continue to do well. We have done well by any yardstick to this point. There is no magic bullet or secret sauce for protecting ourselves from COVID-19. It is a defense in layers. Those layers are the things we have talked about repeatedly and at length. But it starts with distancing and keeping your distance 6 feet apart. It's helped further by wearing a non-medical mask. It is helped even more by reducing the number of contacts outside your daily household. And we've seen figures from Dr. Rahman showing that 6 or less is a manageable number. And once you pass 11, the situation will rapidly become out of control. You avoid overcrowded places for that same reason and prolonged indoor contact whenever possible. But the key we have seen has been around travel, and that is the basis today for the changes the Premier has announced and the further changes that Dr. Fitzgerald has announced. When you move, the virus can move, and a mask will help you reduce that. Essential travel should be the watchword now. We shouldn't be moving around out of the province particularly unless there is some real pressing need to do that. The challenge that we have is the things that we introduce now, we will not see the benefits of for 2 weeks because of the nature of COVID-19. And the situation we find ourselves in now is not because of things that were done today or yesterday, but things that were done over the previous 2 weeks. And we have to bear that in mind. Getting away with it on the day is not what this is about. As Dr. Fitzgerald has said, when we do see clusters, because we will, the response of public health and government will be proportional and focused. We will do our level best, if at all possible, to try and avoid the blanket province-wide restrictions that we put in place at the beginning of COVID. We've learned a little bit more about it. There's still much more to learn, however. Some of the things that we have done over the previous months, you will see other provinces actually now starting to do. It's only within the last week or so that British Columbia has used mask recommendations for indoor public places and made that mandatory. That's something we recognized early on would be a help in protecting schools. And I would argue, compared with other jurisdictions, that has also worked. So others are catching up. On a higher level, strategic note, I received a letter from one of the opposition parties concerning the All-Party Joint Committee on Public Health, and that will be reconstituted, and there is a meeting later on this week to enable discussions at an all-party level. So again, we have done well, but to continue to do well, we must continue to make the efforts that we've made before. This is a marathon, and this marathon will not end until a vaccine is widely available and in people's arms. And realistically, that is going to be towards the middle or end of next year. So we have to take a breath, put one foot in front of another, and plod our way through to the end of this tunnel. There is no way to sprint it. So listen to the advice from your public health officials. Take it to heart, and we'll get through this. And so with that, Premier, I'll call a halt there and turn it back to yourself.
Thank you, Minister. We'll now invite the media to offer some questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Looking at the rate of cases in other provinces, Nova Scotia has about the same rate as we do. PEI, for example, has half the rate of active cases right now compared to us. So can you explain from a science point of view why the risk, for example, of someone coming from Charlottetown, why they present a risk and need to isolate?
Well, I believe right now Premier King is announcing similar measures in Prince Edward Island, and there is some logistic issues of just getting from Prince Edward Island straight to Newfoundland and Labrador. But this is a preventative medicine measure that we're taking. I think it's balanced. The issue is not so much the exact numbers. It also has to do with the science and the epidemiology about community spread, in addition to the frank size of the numbers. So this is a preventative measure that we hope will prevent community spread in our communities.
This is very regional, though. Why not just bring those measures in for people who've been in the areas of the outbreak? And, for example, if someone has traveled to Cape Breton, where they're not seeing an outbreak, they're not seeing community spread, have different measures apply to them?
Well, I think this is the level that we've landed on that is safe for travel within the bubble. We're basically a bubble within a bubble. Patrolling and policing movement around other people's jurisdictions would be quite difficult, combined with the fact that there is this lag period between being infected and developing symptoms. So because you're in Cape Breton today, you don't have symptoms. If you were in Halifax 3 days ago, you still may develop symptoms and you still may be infectious. So this is the measure, this is the firm, unfortunate measure that is balanced, in my opinion, to protect Newfoundlanders and Labradorians.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
In recent days, we've seen municipalities having to take action to help control outbreaks. So what was the situation there?
Well, I've spoken with Mayor Ball quite frequently over the weekend, and he felt this was extra measures that they wanted to put in place. I know he's had discussions with Dr. Fitzgerald, but this was out of an abundance of caution from the town of Deer Lake.
Any plans to implement point-of-entry testing or even perhaps random testing at airports or ferry terminals?
Well, the problem with point-of-entry testing, before I hand it over to Dr. Fitzgerald, is that it hasn't been proven scientifically to establish what we want it to establish. So it creates a false sense of hope for people who test negative. And in fact, when the studies that are coming out now suggest that it's point-of-exit testing of the time of quarantine, which is most effective. And we don't want to create that false sense of hope for people who would test negative at the time of entry. And you can't forget, there is a 30% false negative rate. And so if they're negative at the time of entry, that doesn't necessarily mean they are negative. In fact, there's 3 out of 10 people who would be walking around the community who would actually indeed be positive. So we've landed, and I'm quite proud that Dr. Fitzgerald has put together this protocol for rotational workers, which I think we're seeing as being effective, but is also supported by the science and the modeling, which is how we make our decisions. So, Dr. Fitzgerald, I'm not sure if you have a comment on point-of-entry testing.
No, I think you've covered it. We've always said that point-of-entry testing is just one point in time. It doesn't really give us any information about what can happen going forward. So we do not feel that it is the best place to use valuable testing resources.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Thank you, Kathy. I'm wondering about the elementary school. Can you clarify again, does the entire cohort, or in this case the whole class, have to self-isolate now for 14 days? How does that work?
Yes, so in general, if we have somebody in a class who tests positive, then that entire cohort would be considered close contacts of that positive case, and so would have to self-isolate, as any close contact would have to. In general, most cohorts are a class in an elementary school.
And when it comes to focus for regional measures, a place like Deer Lake, for example, has an airport, it's a crossroads, it's it's a fairly busy place with people arriving and leaving. How would you foresee any kind of a regional approach to Deer Lake should that become necessary?
So at this point, I need to reiterate that we don't have evidence of widespread community transmission in Deer Lake. All of the cases that we have seen to date have been, being able to be traced back to either travel or related to this cluster that was initially related to travel. So, at this point, we don't have what we call non-epidemiologically linked cases. So those are the ones that we're worried about. You'll remember we've talked about those before. When we have cases that we don't know where the source of the infection has come from, those are much more worrisome. So those would spur us on certainly to be looking at more restrictive measures. But at this point, we aren't there, and we're certainly not recommending those kinds of measures in Deer Lake at the moment.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm just looking to clarify on the, circuit break at this point. It's for 2 weeks. So for those from Atlantic Canada, they're not having to apply for an exemption form. So how are we going to make sure to monitor and implement the 2-week self-isolation?
So that's what we're implementing over the next day or so. So they'll have to self-isolate, no different than rotational workers coming from outbreak areas, and we'll be monitoring them, and hopefully we can trace them as best as we can as they come into the bubble. To the Newfoundland bubble, I should say.
Everyone who comes into the province has to fill out a self-declaration form that asks them certain questions about where they're coming from and things like that. So we are able to track through that process who needs to be followed up.
All right, thank you. And when it comes to rotational workers, what advice do you have for those who share custody of children, and if maybe they're 2 weeks to have their children while they're home? In the case of they potentially testing positive, obviously nobody wants that, but if it's their week with their children, they want to spend it with their children, your advice?
Yeah, so they are still allowed to spend their time with their children. Rotational workers are allowed to isolate with their families, and that's why we added in some of the restrictions with regard to adult members of their family having to wear a mask when they're in contact with other people for those 2 weeks. But yes, that wouldn't change. None of these orders will negate any pre-existing custody arrangement.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
I'd like to ask how this affects agreements with the Quebec government for the issues at the Labrador border. Does this change measures that are in place for either on the south coast of Labrador or western Labrador, those measures that were in place?
It does. We are looking at before there was a bit of an open border between in southern Labrador, and so we're looking at having that border closed effectively and policed appropriately for 24 hours a day. And as I understand it, the job that's been completed in Lab West on the Quebec border has been a quite effective and efficient one, and they'll continue to do so.
So for residents of Fairmont or residents of Boulogne-Sablon, will they now have to apply for exemptions? How does this change practically for you if you're a person, say, who works in Lab City but living in Fairmont or something like that?
Well, you can apply for an exemption, but otherwise you have to self-isolate for 2 weeks.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Thank you. Premier, is there any message you'd like to give businesses who are worried they're going to take another wallop after leaving the Atlantic bubble?
Pardon me?
Is there any message you'd like to give to businesses who are now concerned, because we don't have people coming in from these other provinces, that might impact their business?
Sure. The message is that we're trying to protect your businesses by giving this circuit break. We're enjoying we're enjoying this level of freedom, and we're the envy of a lot of other places around the country. We want to keep it that way, and we want other provinces within the bubble to sort out their epidemiology before we open it up again. So this is an effort to protect their businesses, to protect the economy. The last thing we want is a full lockdown, as Dr. Fitzgerald and Dr. Haggie said. So we don't want to get there. So this is a circuit break in order to protect the businesses, in order to protect the economy. And as I said, I would encourage and ask Newfoundlanders and Labradorians to support local during these times that are going to be tough. But again, this is just a 2-week pause, and it's in every effort to keep schools open and to keep businesses going so that the economy can continue on.
Right, and I just want you to clarify a point. This is a 2-week pause, so at the end of 2 weeks, do we rejoin the Atlantic bubble, or do you reevaluate rejoining the Atlantic bubble? So
we reevaluate the Atlantic bubble. Right now, I guess we're a bubble in a bubble, but we will reevaluate joining the Atlantic bubble in 2 weeks. I think it's, again, it's not the raw numbers of people that are infected. It's the type of spread that's occurring in other jurisdictions that people also have to be cognizant of and is weighing into the decision making. So we'll evaluate all that over the next couple of weeks and see where we are. But as I've said from day one, this is a dynamic, and Dr. Fitzgerald has said as well, one thing that we have learned in 2020 is that things can change, and they can change quickly. So we need to have the flexibility to meet the dynamic reality that is COVID-19.
Thank you.
Our next questions are from Sarah Smelly of the Canadian Press. Please go ahead.
I believe you're muted there.
Our next questions are from Sarah Smelly of the Canadian Press. Please go ahead. Okay, we'll go to Peter Cowan of CBC News. Please go ahead.
What are the standards that you're going to use in 2 weeks to evaluate whether or not that quarantine will need to continue or whether or not you'll raise it?
As we just mentioned, it'll be a combination of outbreak numbers combined with the epidemiology in the regions. So whether there's community spread being defined as having no index source that can be traced back. That's incredibly important, and I think people need to understand that is I'll turn it over to Dr. Fitzgerald in a second, but that's a key variable in the decision making. If there's a lot of community spread, then it's really easy to overwhelm the contact tracing. It presents a situation in which there's people walking around that don't know they have COVID-19 and potentially infecting others without any knowledge of it. So that is one variable in addition to the raw absolute numbers that are being seen within other areas of the Atlantic bubble. But Dr. Fitzgerald?
Yeah, so certainly we will be looking at what the responses are. So there are a couple of regions there are a couple of provinces, both New Brunswick and Nova Scotia, that have identified outbreaks, and Nova Scotia has been clear that they have some community transmission as well. So we will be looking at the levels of non-epidemic cases that they have. We'll be looking at the the trajectory of their case numbers. Are they going up? Are they going down? And looking at sort of a 7-day average, that sort of thing. Those are all things that we would consider with regard to whether or not to lift those isolation measures at that time.
We have 3 of our own little clusters in this province. How confident are you that these are contained right now?
So certainly in Grand Bank, it does appear contact tracing has been completed, and it does appear that we have identified all of the contacts to date. Of course, people who have been identified as contacts can develop symptoms, up to the 14-day mark. So we're not out of the woods until we know we've gotten through that, certainly through that cycle from the last known contact. But it does appear right now that we have identified those contacts, and we have that area under control. However, things can change very quickly, so that doesn't mean you can let your guard down in Grand Bank. You still need to be careful, and it doesn't mean you can let your guard down anywhere, really. I mean, we still need to be watching out for physical distancing and making sure you're wearing your mask like you should be, and that you're avoiding gatherings and keeping your contacts as small as possible. With regard to St. John's, that little cluster, again, it appears that it's that we have identified the contacts, but again, up to 2 weeks, we could certainly find more cases as a result of that. The good thing is that the contacts we've identified are in isolation, so there should be little further onward spread. Deer Lake, we're still working through that. It's still in early days, really. Certainly, we're comfortable with where we are now, that we've been able to trace most everybody in this cluster back to that origin. That's very good. So, but it's still early days in Deer Lake.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
Teachers have long been concerned about safety in the school system. Now that we have COVID in school, will there be any changes related to the wearing of masks, for instance? The NLTA is asking that masks be mandatory in schools, and extracurricular activities. How will they be impacted?
So, I don't want to speak for schools, but from a public health point of view, we have one case in a school, and we're certainly not going to create policy based on one case. So we're going to look and see what happens with this. We're going to follow it through. We're going to follow the investigation through. We're going to take learnings from that, if there are any, and we'll make policies that are measured and supported by evidence. That will apply to masks and many other things.
Why Wednesday before implementing this, removal from the Atlantic bubble?
Well, we need some time to implement the measures at the point of entry and to allow the public health officials to create the necessary measures to actually implement it. So it's just a matter of logistics and operations, I guess.
Our next questions are from Peter Jackson of The Telegraph. Please go ahead.
We may have had a family member, a rotational worker, being around seniors. I'm wondering whether this recommendation is actually a hard and fast rule. Are families of rotational workers forbidden by health measure to enter long-term care home?
No, so they're not. That statement is not a part of the special measures order. It is a recommendation that it be avoided as much as possible. Again, we're trying to strike a balance. We realize that if we prohibit people from going into long-term care facilities who are not the travelers themselves, that could cause hardship for care in these people who live in the long-term care facilities. So, we're trying to strike as good a balance as we can. We know that they have to wear masks whenever they're inside these facilities. They have to practice physical distancing as much as possible. They should only visit their loved one and not other people. All of those things would be in place. So we're asking that people avoid those situations, the families of the rotational workers avoid those situations, but we haven't restricted them in a special measures order specifically.
But just to be clear, rotational workers coming from an outbreak area themselves, outside of save their families, are not to be going into long-term care facilities.
The traveler themselves, the rotational worker, would not. That will be in the special measures order.
Okay, thank you. And one other question, Premier Fury, I'm wondering what the other premiers' reaction has been and what measures they said they might be doing.
Yeah, so we had a healthy discussion over the weekend. Premier King is implementing the same measures that we are here in Newfoundland and Labrador. New Brunswick and Nova Scotia are requesting for all non-essential travel between provinces to be stopped. We suggested, Dr. Fitzgerald suggested that last week for Nova Scotia in particular and Halifax, and you saw the media advisory on Saturday in addition to the message last week. So we've gone an extra step from Nova Scotia and New Brunswick, but everyone is gravely concerned about the spread and evaluating them from their own perspective. In this point in time, we have a an added advantage of being somewhat isolated from the other Atlantic provinces, which I think we're going to leverage for our advantage moving forward.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I just want to go to the timeline. On Saturday, you announced that this festival would be happening, allowing 48 hours, which, while it's appreciated for programming purposes, I think a lot of the public started to jump to conclusions and panic buying began. Why not have held this on Saturday and given the warning with more days advance for the Wednesday's measures coming?
Well, part of it was we wanted to see the epidemiology of the virus in the other Atlantic region, the other Atlantic provinces evolve over the weekend. Of course, we had our own outbreaks here to deal with as well. So it was a combination of factors. It was not one in particular. And then, of course, weighing in on where the other Atlantic premiers were, so that we could have a consistent message to the citizens of the Atlantic bubble.
All right, thank you. And I just want to clarify about the man who had returned from Nova Scotia in St. John. The Bigs on Freshwater Road had put out notice that they were temporarily closing as someone who had tested positive had been there. Others that have been there have been notified to that they don't have to self-isolate, but not to come into contact with others. It's kind of a contradicting statement for those who may work in healthcare or in the school system. What is the advice there?
Yeah, so we, Public Health did not order or ask that restaurant to close. The restaurant, I think, out of an abundance of caution, decided to send out that notification to their clientele and staff. At this point, the contact tracing for that individual is completed, and anyone who is identified as a close contact has been advised to isolate and get tested. As with any situation, we always ask people to self-monitor for symptoms and to contact 811 either through calling or online, the online assessment, if you have any symptoms, to see if you need to get tested. And if they recommend that you need to get tested, then we certainly want you to go get tested. We only know about COVID cases if you get tested. So, that's the best way for us to be able to deal with it.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Trying to get a sense of how many people have been affected by the cluster on the West Coast. How many people are currently self-isolating?
So I think I don't have all the latest numbers, because that process is still ongoing, and there is a class cohort that would be isolating now at this point. So that I'm not I don't have the final numbers of those, but there would be in excess of 20 to 25 people for sure now.
And in terms of is there a single straw that broke the camel's back here? Just looking for a clear answer on why this decision and why now.
The decision on the bubble?
Yeah, sorry, specifically.
Yeah, we were looking at numbers in New Brunswick, and we were looking at types of spread throughout Halifax and Nova Scotia in general, and those are some of the variables that were weighed in making this decision. And of course, the epidemiology from across the country as well. Different than in other provinces in the Atlantic bubble, you don't need an exemption to come in. You're supposed to isolate, albeit, but there isn't an exemption in place for the other three provinces. So all of these things were kind of weighing in when we made this decision.
Our next questions are from Elizabeth Whitten of All Newfoundland, Labrador. Please go ahead.
Thank you. I'm curious if this government knows how many people from the other Atlantic provinces visited Newfoundland and Labrador during the bubble lifespan.
I'm not sure. We can certainly arrange to have those numbers to the best of our abilities, but I don't have that off the top of my head.
All right, thanks. And to follow on Patrick's question on self-isolation, how many people are currently doing that? I'm curious, how many people are you currently waiting to hear the test results back on?
I'm sorry, there was an interruption in your question. Yeah.
I am curious, how many people are still waiting to hear back about their test results?
So the test results for the class cohort, of course, they've just been Testing has just been arranged for them today. So that's the main group. And then any contacts of these two latest cases that we have, we're waiting for test results for any of the contacts of these people. But other people, otherwise we have all the results back.
All right, thank you.
Sarah Smelly of the Canadian Press, we still have you on the line. I guess we'll go back to Peter Cowan. Do you have any final questions, Peter?
Yes, I do. How comfortable are you with businesses and municipalities making their own decisions about whether things should be open or closed? I know, for example, in Deer Lake, people said, well, gee, the arena is going to be closed and the town hall is going to be closed. Why aren't they closing schools? Things like that.
Well, of course, municipalities and businesses like the restaurant that we were just referring to often make their own decisions out of an abundance of caution. I'm sorry, there's some feedback on the mic, Peter. Out of abundance of caution, and we can't control every business around them, whether they should open or close their doors at this particular moment if they want to go outside an extra step of public health advice. But I will tell you, Dr. Fitzgerald has been in touch with Deer Lake and helped form how they kind of made their decisions. But they have their own buildings and their own employees that if they want to go beyond the public health advice, then that's an abundance of caution on their part.
If I can add, Premier, I would certainly encourage any community, any business who has questions, if they are in a situation where they've been identified as having cases, and they want to discuss any of these types of questions with public health, we welcome the discussion. The regional health authorities certainly are quite accessible to anyone who would like to reach out and have a discussion. We certainly are quite happy to provide public health advice.
I've got one more question just before I go on. I'll just ask whoever joined the line to just mute their microphone because we're hearing a bunch of feedback there. But you've said that the cases on the West Coast are tied back to a rotational worker. But when I look at the cases that have been announced, it doesn't appear that the rotational worker has actually shown up in our positive test there. Can you explain exactly what's going on there?
So not everybody gets tested in Newfoundland and Labrador. So in this situation, and I don't really want to speak to specifics of somebody's individual case, but in some situations, the person may have gotten diagnosed elsewhere, and then we become informed that they are a case. And then, we take that information, we put 2 and 2 together, and we make the decision about where the exposure would have come from.
Okay, thanks.
Linda Swain, do you have any further questions?
Just one. Has the province seen many requests for travel exemptions leading up to Christmas? And if so, how many?
We certainly have seen quite a few travel exemption requests. I think before we made the decision about whether or not to expand the visiting over Christmas there a couple weeks ago, we had 400 or so in the queue. And we continue to get a steady stream of requests. I can't give you the exact number, but we can certainly get that for you.
How many were approved, do you know?
Generally speaking, if they were just asking to come for a visit, then none of them would have been approved. But there may have been some with extenuating circumstances that might have fit into some of those exceptions that are in the special measures order.
Peter Jackson, do you have any further questions?
No, I'm good, thank you.
Kellyanne Roberts?
I have one. Are we still having the regular briefing on Wednesday, or does this take place with that?
No, we'll have an additional briefing on Wednesday.
And are we going to expect briefings to continue more frequently leading up to the update, or are we just sticking to one a week?
We'll play that by ear on the information and the frequency of cases and the requirement to update, but we'll certainly we'll play that one by ear for sure.
Great, thanks. I'll save the school one for the school briefing.
Patrick Butler, do you have any further questions?
Yeah, just a couple quick follow-ups on the Labrador border. Is the timeline the same for those 24-hour-a-day controls to go up on the Labrador border as well? So as of Wednesday?
My understanding was, and I'll clarify it if it's different, that was being implemented immediately, but I guess there will be some lag time in kind of operationalizing that.
And just on the Labrador border again, there aren't any cases in the Labrador Health, the Grenville Health region right now. This is going to have an impact on border communities. Was there discussion over how you could limit the impact on Labrador and maybe not implementing these tough border measures, given there isn't really a prevalence of cases in that area?
We're evaluating everything, and we're looking at, of course, cases not just on the Labrador side, but on the other side of the border as well. And we think it's important, obviously, with the open border that you have to previously open border, you have to evaluate both sides of the border. And as we suggested, if there's extenuating circumstances like travel for health or other things, then there's availability for exemptions to the rule. But right now, given the prevalence and the incidents in some of the border communities, we think that this is the most prudent and responsible measure right now.
Thank you.
And Elizabeth Witt, do you have any further questions?
Yeah, I just wanted to confirm my math. We currently have 23 active cases?
I'll have to... active cases, I have to say, it's something that we talk about in the media a lot, but for us in public health, active cases aren't it isn't the number that we're most worried about. We're worried about the cases we don't know about. Active cases we know about. We've contact traced them, and we've isolated their contacts. So I'll have to get that number for you.
Okay, because I remember seeing other people report over the weekend, 21 cases, 21 plus 2 today.
Yeah,
it's certainly that I would trust your math on that, but I'd have to confirm it.
Yeah, it's being confirmed in the room here that it's 23.
Perfect. Thanks so much.
Thank you very much. Premier, do you have any further comments before we close today's briefing?
No, I'd ask everyone again just to be calm in the face of change, and please look after yourselves and each other, and together we'll get through this.
Thank you, Premier. For the benefit of our viewers and listeners, at 12:30 p.m. we will transition to a media briefing with the Honourable Tom Osborne, Minister of Education, Tony Stack, CEO, Director of Education of the Newfoundland and Labrador English School District, and Dr. Janice Fitzgerald, our Chief Medical Officer of Health. So if you would, all reporters would please stay on the line, and we will transition at 12:30.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.